Sometimes we've done our treatment options with you and we aren't effective. We've tried epidurals, we've tried facet blocks, we've tried physical therapy, we've tried medications, and we just aren't getting there. Perhaps you've even seen the surgeon and the surgeon doesn't want to treat you, or you've decided you don't want to do a surgery. That's when we might talk about spinal cord stimulation. And what spinal cord stimulation is a way to block the pain. Now remember when we talked about the philosophy for treatment, number one was fix and cure something. This is not a fix and cure. Philosophy option number two was block the pain. That's what spinal cord stimulation does. Option three was cover it up. That's not what this does. And number four is teach you to ignore it. This is not that. This is block. This is a high-level treatment. This would not be a first-line treatment. We wouldn't do this right off the bat. But if we've been working with you for a while, we get a sense that we're not getting this handled another way, we may say, maybe it's time to look at putting electrodes in the epidural space and electrically jamming the pain signal. That's what spinal cord stimulation does. So the way we would do this is we would talk to you about it, and if you're agreeable to consider it, we're going to consider doing a trial where we let you test run it. We'll put it in partially, let you run with it for a week and see how that works, bring you back, take it out, and make a decision whether that was effective. If you agree that you want to consider that, we have to get a psychological evaluation. That's what the insurance companies require. Then we bring you back, lay it on the table, access the epidural space. Now, if you have low back pain, we still access the epidural space a little higher. Slide the electrode up within the epidural space to in the mid-thoracic spine. Place a second lead in, also in the lumbar spine, and we slide it up into the mid-thoracic spine, and then we just suture these down to the skin. There's no cut or anything, it's just the puncture. Suture that to the skin, put the battery on your belt, and let you walk around with that for a week. Now you can't bathe or shower during that time, but you can please sponge bathe. Point is, we can't let that get infected. So you are active and you do your thing for a week. You come back and you tell us how that went. Only if you get 70% relief or more would we decide to move forward with implanting it. And that's not because I don't want you to get relief, but if you don't get 70% relief, what we found is you don't do well long term. It starts dropping off in effectiveness, and then you have a battery and you have something in that's just not worth it. It really needs to give you 70% or more, or we shouldn't consider that. Let's wait for something later. But if you do get more than 70% relief, then we'll bring you back to the surgery center. We'll discuss with you where we put this battery, and that's about the size of the battery. It's not a huge thing. They'll get smaller and smaller over time, but this is the present battery we use, and that'll probably work for 10 years or more. And so what happens then is we bring you back, we've taken the trial leads out, so now we have to put them back in. And so we would surgically implant those, which is just a procedure, it's really not much of a surgery, and then we do have to surgically implant that just under the skin in either your buttocks or in your low back, above your buttocks. And so the point is, you'll have this under your skin that you either recharge every couple days, or there are systems that you don't have to recharge at all, and that you just let that block your pain. And so spinal cord stimulation is an option when we're looking to block the pain for chronic nerve conditions, either affecting the back or the leg or the neck or the arm. Increasingly now we're using it for abdominal pain and pretty much any pain, because no matter where the pain comes from, it has to go through the spinal cord to get to your brain. And so blocking it at the spinal cord level is really a very effective way to go. Thank you.